Omuuonge Uozombuze.
Amaba hoasa.
We'll quickly now jump into today's sessions, and I would like to ask Marcus to introduce our first session.
Absolutely. Thanks a lot, Teresa, and thanks to all who contributed. And once again, good morning. I can see highlighted now Lulu, and I'm pretty sure we're all looking forward to the graphic facilitation today. And I can already read the words massive attack in the back, okay? And that is what we will be talking about in our first session. Global health emergencies, such as the COVID-19 outbreak, present a challenge in terms of ensuring wide availability of trustworthy information that can help preserve public health and lives. There will be and are rumors, mis- and disinformation to contend with, which can lead to hasty reactions and excessive restrictions on content and dissemination of information on the part of governments or private actors, such as operators of online platforms. Many African governments were aware of the potential dangers to freedom of expression posed by rapid moves to exert greater control over the flow of information and consequently refrained from such measures. This was not the case in Zimbabwe, however. In fact, Zimbabwe saw a surge in assaults on journalists and arrests in connection with the coverage of the coronavirus crisis, making it the biggest press freedom and free expression offender in Africa following the outbreak of the COVID-19 pandemic. Reyhana Masters, Africa editor of the International Freedom of Expression Exchange, has monitored and analyzed these and broader free expression developments on the continent for many years. Her career in journalism spans over 3 decades. She's well known for her advocacy work as a promoter of media freedom and free expression on the African continent. She has, amongst others, served as member of the MISA Regional Governing Council, chairperson of MISA Zimbabwe, and a council member of the Voluntary Media Council of Zimbabwe. Reyhana's monthly regional briefs for IFEX is a must-read for those who want a deeper understanding of free expression developments on the continent. Here she is to lead our first session this morning, a discussion on the impact of COVID-19 on journalism and human rights in Zimbabwe. Could we have an applause, please, ladies and gentlemen? I think we can do that in the morning. Okay, getting started. Reyhana is not alone. She's joined by Zenzele Ndebele, a journalist, entrepreneur, founder, director of the Center for Innovation and Technology, and a member of the Matabaland Collective, a network for civil society organizations and churches based in Bulaya, which aims to tackle issues related to freedom of expression in Zimbabwe. He was also a former MISA board member, and together they help us understand the dire consequences of the crackdown on journalism and free expression rights in Zimbabwe, and the need the rest of us not to stand by and watch, but to act in solidarity with our colleagues there. Reyhana, I hand over to you.
Hi, thanks, Marcus. Appreciate that. That's quite a sort of, introduction to live up to. Talking about adapting, I think one of the main issues for me was adapting to being online, trying to facilitate online, having discussions online. It's very, very different when you're in a room and being able to see participants, because you read the room a lot better. It's far more difficult when you're doing it online. But, we have been having from, the discussion the feedback you've had this morning, I realized that there must have been strong engagement and, a lot of discussion around the issues. And the takeaways are very interesting. I'm sorry I couldn't join you for the discussion yesterday, but your feedback allows me to give, to get a good insight of the kind of discussion we had. Anyway, first of all, thank you very much. Namibia Media Trust, MISA Malawi, and DW Academy. I'm honored to be here. So, and Zenzele, welcome. It's nice to see you online. We can't see each other personally in our own country, but at least we can see each other online. Zenzele is a colleague, a friend, and somebody I've worked with for a long time. So I'm very, very keen to hear his insights. And yeah, let me kick off the discussion. You know, while countries, when the global pandemic first started, most countries were basically working towards setting up their medical infrastructure and focusing on that. How were they going to cope with patients? What were they going to do? What was the protocol? This was something new. This was something unprecedented, on the continent and worldwide, okay? However, our African countries started looking at legislation. They looked at restrictions, and instead of putting in place measures to assist citizens in the medical sector, they were more rapid in putting legislation in place. And I think Botswana was the first one, if I remember correctly, and they were followed by many others. And also, one of the things that most African governments were very strong about was enforcing the restrictions, enforcing the lockdown. And in that process, obviously it was mostly citizens that were targeted initially, and of course journalists. And in Zimbabwe, that was definitely the case. But I'm going to hand over to Zenzele. He can bring us into that kind of space and give us give us all a very strong picture of what actually took place. Thanks, Zenzele.
Okay, good morning to everyone. My name is Zenzele, as she has said. Yeah, I mean, when we started in March, when we were talking about COVID, to me, it was just, something that people were talking about. But this is my first week at work after having caught COVID and gone in isolation, and happy to have recovered. But now when we talk about COVID, we're talking about something that I went through, and that has changed probably even the way we are reporting about COVID, because we talk about now, I mean, in the office, we talk about lived experiences, because we had about 6 guys or so who had COVID cases in the office. But all the same, it's quite interesting that we are having this discussion today. Basically, I represent an organization, or I run an organization called the Center for Innovation and Technology, which is an open space that was established in 2015 and registered in 2016. We are basically a digital-based organization and a creative hub. And for us, that has always been the idea from the onset that the future is digital, and we want to put our content in the digital space and use digital spaces for engagement. So at the core of CITE is the notion of the cyberspace, that it has become the backbone of...
Hi. Okay, die Uhrzeit, Mensch.
Okay. I'm sure there's someone who's talking to someone. Okay. So at the backbone of, or at the core of CITE is the notion that cyberspace has become the backbone of the organization's programs and activities. So we use Facebook, Twitter, YouTube, WhatsApp, Instagram to disseminate our information. So lockdown and COVID, how did that impact on journalism and journalism training? Zimbabwe reported its first case of COVID on March 20, 2020. And what is interesting is that 10 days later, on March 30, Zimbabwe went on a lockdown. Initially, it was supposed to be 3 weeks, and then it was extended for several months. So if you look at it back in March and now, when we went in lockdown in March, I think we had less than 10 cases, or even less than 5. So because it was 10 days after our initial case that was reported, but we still went on lockdown. Yesterday, Zimbabwe reported 95 new cases of coronavirus. And cumulatively, we now have had about 11,000 cases and nearly 300 deaths. So my question is, I always ask myself, was it really wise for the government to do a lockdown serious lockdown that we went into in March. Because now looking back, probably they should have just closed the borders, because people went into lockdown and everyone was so serious. For 6 months, people were just being abused, not being allowed to go out. And then now we have really cases, serious cases of COVID, and it's now business as usual. All those restrictions that were there when we had 10 cases, they are no longer there. So you ask yourself, what was it about COVID? Or it was the government flexing its muscle. So in Zimbabwe, the problem that we had was initially government, journalists were not classified as essential service. And that presented a lot of problems, because it was, when our lockdown started, you were not supposed to go into town if you are not essential service, or if you were essential service, you were supposed to have a letter from your employer stating that you're supposed to be at work. There were roadblocks manned by police and soldiers, and a lot of human rights abuses happened in those roadblocks, because people would be beaten up or made to, bite a stone the whole day, because they dared to leave their homes. So a lot of journalists were arrested. According to Mr. Zimbabwe, more than 30 journalists were either arrested, harassed, or assaulted by security agents and state, those who were implementing lockdown, especially the police and the soldiers, for breaking COVID lockdown restrictions. And then what was the problem again for Zimbabwe was every year, if you're a journalist, you have to renew your press card. So we normally renew our press cards around February. The media council comes down to every town to register us. But at the time when they were supposed to come down, that's when there was COVID. Then they published a statement saying that Zimbabwe, because of COVID, so we can use 2019 press cards. So you go to a roadblock, you meet a soldier who cannot afford a newspaper, or who is not even interested in a newspaper. He asks you, tell him I'm a journalist, and he says to you, no, you can't be a journalist because you are using an expired press card. So then you need to start explaining, no, it's because of COVID. And so most of the times you spend 30 minutes at the roadblock, because we ended up having to call the police spokesperson, call the Minister of Education, the Secretary for Information, to explain that, no, there was an advert in the newspaper, so these guys can use this accreditation. And sometimes you also had to carry the newspaper cutting or the screenshot of the TV advert to say, yes, it's a 2019, but the government have said. So that presented a lot of challenges. And a lot of journalists, some of them lost their equipment because the police or the soldiers will find you filming, and they will take your equipment, or they'll beat you and your camera will, you'll be damaged. So we had those problems initially. And later on, well, it became bit better in terms of that they now knew that journalists can move around, but we still had those restrictions that journalists were still arrested, and some of them will be arrested even if they had the 2020 press card. And so that's what happens. Sometimes the policemen or the security agents just doesn't want to see someone carrying a camera. So those were the challenges. But also for some of us, COVID was an opportunity, in the sense that we had kind of like rehearsed for 2 years to be online. So we were now conversant of what's happening online. We knew the kind of platforms that we would use, the audiences that we had, and what people wanted. So when there was a lockdown and people were now supposed to go online, for us it was an opportunity. So all of a sudden everyone had to social distance and go digital. And they were where we wanted them to be. So mainstream newspapers were struggling to sell their copies on the streets, and they were starting to experiment on using e-paper and all those kind of things, finding new models. We were already miles ahead. So we already knew our target. We already knew what the audience wanted, the content, the format. And while other people were sending videos that are like 50 megabytes or 30 megabytes, we knew that most of our people are using Twitter or mostly in Zimbabwe it's WhatsApp. So any content, any video that is more than 8 to 10 megabytes, people are not going to download it, because for them it's too much for their data. We knew the format that they wanted. We knew the kind of content that they wanted. So we were like, okay, finally, this is what we've been waiting for. So the first week of April, just the first week of the lockdown, our audience on Facebook moved from 200,000 a week to about 450,000. That was the same thing on Twitter. You know, our audience, our reach on Twitter doubled or tripled, because we usually reach about 1 million people a week. And during the first week of April, we went up to about 5 million people a week. Because everyone now was not, you know, I always, people say there are two ways to rule the world. Is either you sell hope or you sell fear. And undemocratic governments like ours usually sell fear. So the first lockdown was, you know, sold seriously in terms of fear of COVID, fear of the security agents. So no one wanted to go out. Those who went out was because they really needed to go out. So we saw a lot of people defaulting in their medication. Those who were in ARVs, they could not go to hospitals because they would be returned. And you knew if the police found you on a roadblock without a letter, they will make you sit down in the sun for the whole day. So people didn't want to go out. Businesses were closed. So there was no conference to attend. There was no official government statement on anything except COVID most of the times. Business, there was no parliament. So content became scarce. You really needed to, you know, usually what happens with journalists, I was actually talking to my guys yesterday that, guys, do you realize that we had more content during COVID than we have now? Because what we are now doing is they kind of like follow the journalism, follow the minister kind of journalism. You go to a conference, you tweet, you say the minister has said this, National Health Council have said this, and all those things were not there during COVID because there was a lockdown, there was no gathering, there was no official business, businesses had closed. So we needed to dig deeper to find content. So what did we do? For us, we went to rural. We started going to rural areas, you know, talking to communities in the rural areas. It was safer because there was no lockdown in rural areas. You cannot lock down people in the rural areas. So because we could be able to go out of town using our press card. So we went deep down in rural areas, started talking about the projects that are happening in rural areas, the life in the rural areas. It was normal business in rural areas because they're already social distance. You know, so your next homestead is 200 or 300 meters from the next. They usually don't gather that much. So they will wake up in the morning and do their normal business. So we thought this is where we need to go and cover the stories. But initially it was not planned. It was the only place that was there where we could go. But what happened was all of a sudden, rural communities that are normally ignored were in the mainstream. So we went to areas talking about water shortages, you know, projects that are going on. And these stories found themselves in the mainstream news because the other newspapers, they had nothing, they had no content. So they were forced to share our content and pick our content. And that was an advantage for us because we started doing something different. The other thing that we utilized was WhatsApp groups. You know, CITE has about 6 or 7 WhatsApp groups, and each WhatsApp group is an average of about 200 people. But what I found interesting with these WhatsApp groups is that we have, you know, senior government officials in these WhatsApp groups who just, you know, get in this WhatsApp group, never say anything but consume the content. We have guys in the police, guys in the military, health services, you know, very strategic institutions. So initially, or even up to now, so when something happens, when a police officer attends to an accident, and he happens to be in our WhatsApp group, he usually sends us a message, guys, there's been an accident in this place, can you come and cover? When someone prominent has been arrested, they will always give us a tip. So we were, you know, we relied on our WhatsApp groups for news stories because there were no gatherings. So we'll go specifically where there was an issue and cover stories. So our coverage became much better during COVID, during the lockdown, because we now had sources and people thought, you know, if you tell CITE, they will come and cover the story. So that was a plus again for us, and it made us, you know, get a lot of content. There were civil society organizations, which I'll then also talk about it when I talk about training, that organizations also now wanted to train people and they wanted to do it digitally. And that was one area where we were good at. So we used WhatsApp, we used these WhatsApp groups to distribute the sources, the information that we had. You know, our model was never about, or from the onset, our model was never about selling anything. So we didn't want to, we were not printing a paper. Our model was, first of all, we get the audience. And when we get the audience will lead us where there's money. If we can get the message out, then money will follow the idea. And it worked perfectly fine during lockdown, because even our revenues, we got new programs. Everyone then started saying, no, but what if you give CITE another 30,000 to do this, or another 40,000? So during 2020, I think this year has been successful in terms of fundraising. We are not where we want to be, but compared to other years, it was quite interesting, because we got grants that normally we would not get, because we could spend the money and other organizations were failing to spend the money. So people were inviting us to spend money on their behalf, because we were very active on social media. Then lockdown gave us, so the WhatsApp groups gave us a lot of tips. But while we were enjoying these things, there were also challenges. And I've also mentioned some of these challenges, that despite the increase in the reach, you know, the human rights situation was not good. And for some of you, you remember that around July, we had the hashtag Zimbabweans Lives Matter, because during that time, there was a proposed march or lockdown or shutdown by the opposition. And the government, they heavily came down on people. You know, there was a serious crackdown on journalists, on opposition, on activists. I mean, from July 24 to about August 1. A lot of people were assaulted, were kidnapped. You know, we had this new phenomenon, which was always there, but this time around it was pronounced, where there was a crack team called the ferret team, that went around, you know, at night, kidnapping people. So after the initial 3 weeks lockdown, somewhere around May, the lockdown tightened, and the government imposed the curfew, dusk at dawn curfew, where after 6 we were supposed to be home, and before 6 we were supposed to be home. Initially, then we started asking, so I mean, does COVID become so active after 6 p.m. or what? But the idea was, these guys knew that if there is a curfew at 6 o'clock, everyone will be at home at 6 because bars are closed. So they knew that they wanted to crack down on opposition. They wanted to crack down on journalists and on civil society. And if there's a lockdown, you'll be forced to go. I mean, there's a curfew, you'll be forced to go home. So they knew that if they are coming to pick you up at 7 or at 8, they'll find you. But usually they will come around 12 midnight and they'll pick you up and they'll go and assault you, you know, torture you and dump you. No cars were allowed to move at 6 o'clock, I mean, after 6 o'clock. So no one will come to help you. So in Bulawayo alone, we registered there, I think we recorded over 24 people who were adopted. At one point, I had to leave town actually, because there were those threats that, you know, there was information that these guys would have loved to have 1 or 2 words with me. And I knew what it meant. And I knew that if these guys get you at 12 midnight, they will beat you up until 4 a.m. if they want. And they will dump you and no one will be able to come and pick you up. Even if you tried to phone someone. So some of the guys who were abducted and beaten up, I had interviews with them and they would tell me that, you know what, I called 5 people, but these people were intercepted by the same guys and they were also beaten up. So no one will come and help you. So those were the challenges that really, you know, affected the otherwise, you know, the whole, you know, bright side of lockdown, giving an opportunity to online. Human rights abuses were very high. A lot of people were killed. I'm actually doing a documentary right now about human rights violations during lockdown. And I think so far I've recorded about 3 people who were murdered by the, not even, I mean, murdered is light, were killed by the state, more like the extrajudicial killings. These people were killed by the police, most of them, and all of them. And up to now, no one has been arrested. And also, I've talked about some of these challenges. There was also the issue of the challenges when it came to training. You know, we had to to do trainings. I mean, there are a number of trainings that we do at CITE, and also during that time I was actually working with other guys and the Malawian guys too. We had a journalism training that was going on in Malawi, but I think the last trip was around 19 January when we did our first course in investigative journalism, and we could not travel. So training became a challenge. It also became an opportunity because now we had to move our training online. So as CITE, we came up with a training platform called Funda Online, where we then put some of the issues, some of the courses, or either done by us or on behalf of civil society. And it became more like a revenue generation project because people were paying for us to do those courses. But also then Zoom, Microsoft Teams, Google Class became the platforms of choice. While it was a good thing that journalists, all of a sudden, we had to think outside the box, we had to do the training, and the Jamboard became the buzzword, and Nero and all these kind of things. We had to sit, I remember the DW Academy training of trainers, 3 days, full day. And when we went to some of the recommendations, the comrades were saying, this training of 9 to 3 p.m. Is just too much. So that was the part of the training during COVID, that we had to learn new ways of training. But for Africa, there were limitations. So one thing that I didn't mention was our honeymoon with the audience and having huge numbers ended sometime in mid-April because the major mobile network here, the biggest of them, Econet, increased their data charges, their data prices around April. And our numbers dropped. Although they peaked on later again, but they were never the same. And what I've discovered now is they now, regularly increase their charges. So the week they increase their charges, our numbers go down by almost 50%. And then 2 weeks later, people, get used to it and they come again. Once you start picking the numbers that way you were, the prices go up again. So journalism training went online, but we also had those challenges of connectivity. I remember our first online training with the Malawi guys was almost something else, but we adapted. And also because we are training younger journalists, we have a generation of journalists. Some of them don't even own a computer or a laptop. They use their mobile phones to write their stories, and they go to work if it's not locked down, and use computers at work to write stories. So when they're working from home, they're using their mobile phones to write stories, to do videos and send it to you. So we are now training and we're asking the guys to log on Zoom and then use Jamboard. They're using one device. And the Zoom experience on a mobile phone is quite different from on a computer. So we faced those challenges that we could not then train as we wanted. We could not get the guys to go on Jamboard and other platforms at the same time using their mobile phones. So we had to adjust. And this is why today probably those adjustments, you can see them, that people are using Zoom and WhatsApp. And what I've been talking about right now is how do we cater for the journalists who don't have computers? Can we do trainings that can only be done on WhatsApp? So the future looks exciting because we are still coming up with the better ways of training online using mobile phones. I think the challenge of COVID is still with us because in Zimbabwe, in South Africa, and other areas, we're already talking about the second wave, which happens to be more, I think, more deadly, I think more serious, and mainly because the restrictions that were initially there are no longer there. Countries like Zimbabwe cannot sustain to keep the businesses closed. But also we don't have enough facilities. 9 months later in Zimbabwe, we still don't have a facility that is ready to deal with serious COVID cases. So when I was
Zenzele, maybe I can pick up from there.
Yes.
From your presentations, because I'd like us to have a conversation around many things. There's a few questions, but before we go on to that, I just want to, sort of bring your, center your discussion. I think what you focused on was adaptability. It looks like, you know, you use the experiences to be, to adapt to the situation. You found your strengths and you went back to the community. And for me, it sounds like on your part, you looked at it as an innovation, but really that is what journalism is really about. Going into the communities, telling their stories. So Zenzele, I've got a number of questions for you, just to start a conversation. One of the key issues is, yes, you went into the communities, but what you've rightly pointed out is that these communities do not have access to online apps or online platforms, okay? Which is where a lot of the conversations around COVID-19 were taking place. So how do you try and, you know, bridge that, okay? That's one of the questions. Another thing was, yes, a lot of these conversations were taking place, as you very well know, and as we've seen on Twitter, on Facebook, but mainly on WhatsApp. And one of the key issues there is verification of that information, the accuracy of that information, and how do you take those online conversations offline and then back again? As you again mentioned, human rights was a huge and critical issue. And Emmanuel here is talking about, you know, the issue of rights was not really discussed by the media. There was a huge clash of rights. One of the key things for me in Zimbabwe, and I think you remember this conversation, Zenzele, that was taking place on Twitter and on WhatsApp, was the conversation around, you know, accessing medical care facilities. And the fact that there was no, while the government had, you know, put in provisions for patients who were going to report with COVID, and hospitals were kind of, you know, looking at how to set themselves up and the protocols they were going to use around COVID, they forgot to cater for pregnant women. So initially, there were no facilities that they were able to access. And that conversation really was not really ignited in the media. You know, so how do we, when we're talking about restrictions, when we're talking about the intersection between journalism, human rights, and restrictions, you know, Zenzele, how do we pick up on those conversations? How do we as the media take them forward, you know, and how do we ensure that those rights are also being focused on? Maybe you can start off with that and then we'll continue.
Okay, I'll briefly try to answer some of the questions that you have talked about. I mean, let me start with medical facilities. I mean, the issue, I found that journalists probably were not aware with the challenges. If you look at the stories that were covered around COVID, mostly were fear-mongering, maybe it worked, but also no one actually talked to patients who had tested COVID and positive and gone through the system to say, how is it like? I didn't know about it until I went through it. So when I tested positive, my question was, if I develop serious symptoms and have to be hospitalized, where do I go? Our local authorities then said, they came and told me that they were going to test my contacts. Almost a month later, they've not brought the results back. And those issues, you don't see them in the mainstream media. So when we talk about, like, women were really affected big time. I know a student, a nurse, who died. She had a kidney problem. She had to go regularly on dialysis. And then hospitals started saying, we will not attend to you if you don't have a COVID certificate to show that you don't have COVID. She lost her certificate in a bus when she was supposed to go for dialysis. The hospital refused to attend to her and she died. So all these stories, we don't see them in the mainstream. And there are a lot more stories around the challenges. I mean, we were told to isolate. So here I was at home, isolating with my family. No one wanted to come and see us because we had COVID. The stigma was high. Then we had no water because water comes once a week. Someone had to go to the borehole to bring water. Someone had to go to the shops. So that's the day I discovered that the whole issue of testing temperature is nonsense. Because you go there and you test 36.2 like everyone else, and you know that you have COVID. So it's those issues. Then you talked about verification. One of the areas that CITE really expanded on during COVID was fact checking. So we started a fact-checking desk where we're fact-checking some of the issues that were being circulated on social media. So we simply find a fact on WhatsApp that is circulating and look for facts, because up to now, there's a lot of misinformation around COVID. People don't understand what it means to be positive, what it means to quarantine or stay at home for 10 days if you have no symptoms, and for 14 days when you are sick. So journalists still lack in terms of, really breaking it down to people. I was talking yesterday, there was a conference, and I just passed by the conference, and I realized that throughout the conference, people were wearing masks. Then there was lunchtime. They sat around the desks, the dinner table or lunch table, they removed their masks and they started talking to each other. And I said, so they're wasting time. Why are you wearing your mask? Then you go and eat and you start talking to each other and you're not socially distancing. And these are the issues that we don't highlight in the mainstream. So fact checking was quite a big issue for us, and it is still an issue. Then there's also the issue of connectivity, lastly, that you talk about. The reach, how do you reach the rural areas? I found that WhatsApp was the way to go. Unfortunately, with WhatsApp, you cannot quantify how many people you have reached, but you always find that the message comes back to you twice or thrice, and you also hear people talking about it. I started a podcast in Kalanga during lockdown, and I was basically wanting to talk to my people in my village. What was interesting was I'll do a clip saying, hi, my name is Zenzele Ndebele, and today I'm talking about this. If you have any issue, send it to me. And I simply compiled those voices, do the podcast where people are complaining about issues, call the MP, ask him to respond and send it back. I got voice notes from all corners of the Kalanga community, including those in the diaspora, Cape Town, Australia, London. So I realized that these voices are actually going out. And WhatsApp was bigger than Twitter. I'll get more feedback on WhatsApp than I'll get feedback on Twitter. So I think WhatsApp is one platform that we really need to utilize and find more ways of making it useful. I think I'll end there for now. I think you're on mute. We can't hear you.
Hi, sorry about that. The challenges of adapting to technology. You talked about verification, fact checking. One of the critical rights that was stifled during COVID restrictions was access to information. In fact, MISA Zimbabwe took the challenge up legally, and they went to court because initially we were not getting any information around COVID-19. Maybe I can call on Frederico or Zoe to talk more about, how access to information was impeded, and some of the the challenges around that, and also how people were able to go around that. Maybe Frederico or Zoe, you could respond to that. Hello, if they're there, that's it. That is.
Hello, everyone. I hope you can hear me. Zoe here. We did quite a lot of work, I think, around monitoring how access to information is being impeded. It was impeded in terms of the states of emergency legislation that was passed, or certain levels of these states of emergency legislations that were passed in various countries, curbing on access to information and people's ability to, critically also access and review the information that was being made available. I think, Namibia was probably put forward as at least one country or one environment where the government of Namibia made a concerted effort to make available information timeously, probably as accurately as they knew how to at the time. But even then, our concern was, and we spoke about it very publicly, was the unidirectional flow of information. Because, I mean, information is out there in the public domain, but the information is flowing purely from government to citizens. And the media is very limited in terms of their ability to look for alternative sources, and then also to verify that information. What we did in Namibia as a Namibia Media Trust was to facilitate a platform called Ask the Experts. This Ask the Experts platform allowed journalists a confined space, a safe space to interact with medical professionals, particular government officials, to ask those questions that they could not necessarily ask in those platforms facilitated by government, that was very controlled. So we had to, as a civil society organization, provide alternative platforms for media to engage with the experts and with other government officials. And that is how, I suppose, at least in this part of the world, we dealt with, to the best of our ability, with access to information, but also importantly, access to quality information, because it's not just a matter of accessing information, quality information, verified information, and information that really holds value for the readers, viewers, and other consumers thereof. I don't know, Federico, do you want to add? I know Federico was very concerned. He has done a lot of work around fact checking. And the avalanche of information that people had to deal with, that was a particular concern for him, and also an issue that, I mean, definitely speaks to information and the quality of information. Fred?
Can you hear me? Is it fine? Does it sound fine?
Yep.
Yeah, I mean, so what we had was sort of from March, April, was this flood of disinformation, falsehoods around everything from you know, cures and the causes of COVID-19, the 5G things, and all sorts of, you know, all sorts of nonsense. There were serious communication missteps by both the government, public health authorities, and the media at that stage, most of the media at that stage, who weren't engaging with what was busy unfolding to a degree that you saw in other parts of the world, for instance. And that was what was fueling, because there was this information vacuum had developed as that first wave hit us. And these authorities didn't step into that vacuum sort of decisively and assertively to try and close the gap of what was busy emerging, you know, what has since become the disinfodemic. So this was busy happening. And then eventually when there was a response, the response was a criminalizing of misinformation, of fake news. And Namibia at that stage followed what was happening in South Africa, and in Zimbabwe and Botswana, across the region. I mean, I think something like 30, according to Global Partners Digital, that site, they have 31 African countries introduced, you know, sort of COVID-19 related misinformation, disinformation regulations. And a lot of these regulations were then used in other parts as repression tools of legitimate expression. In Namibia, what we saw instead was, and we point this out in a July paper that we did on where we sort of made some observations about what we were seeing in this space, in this communication space around COVID-19. So what happened was these criminalizing regulations of misinformation, disinformation were introduced, but they were so broad and they were so they were so clumsy looking that it was immediately clear that there would be a constitutional issue with the enforcement of these regulations. And I think it was also realized by the relevant authorities, by the Justice Ministry, by the Health Ministry, and so on, because actually, if you look at them, there was actually no real enforcement of these regulations. There was one instance where a person was charged, but this was because this person had made a claim about a company, saying that most of the company's employees had tested positive for COVID-19, and their customers, people shouldn't go there and do business with them. And the company itself then went to the police and later charged, and this person was fined $2,000 Namibian. Now that's the only example of somebody actually having been charged with, under this, and that was only because one of the actors in that situation actually made an effort to do that. Otherwise, there was no law enforcement sort of push to enforce these regulations. But still, they remain concerning, and they're still there, even though we've come out of the state of emergency and we've come out of the lockdown conditions. But those regulations are still there, and we've seen what happened in other parts of the continent where regulations like these have been used for repressive purposes, and we don't want to see, because they criminalize online speech without defining or sort of the areas that have been criminalized. So it's very broad in terms of its application, which is where the constitutionality comes in. And it would be, we want to discourage, and we have been making use of various platforms to discourage these regulations now being used, because what we're hearing now are sort of rhetoric around social media regulation throughout this year now, and we want to discourage this. These regulations now being used to bring in bad policy, bad social media regulation.
Frederico, maybe I can take it up from there. Yeah, thanks.
Yeah.
Thanks.
Yeah,
That was very
yeah.
insightful. Frederico is absolutely accurate. A lot of legislation. So basically, the issue was around fake news. Everyone is using that terminology, which I feel is very inaccurate. It's more about polluted information. Okay, and maybe that's a term we can start using. And governments, trying to put in legislation where they were not successful in amending legislation, they decided to use cybercrime legislation. Okay, and in many of these countries, instead of using the laws to prevent cybercrime, they were using cybercrime legislation to actually jail journalists, okay, or arrest them and keep them detained. So Frederico has brought out a very critical issue, the fact that, so what I'd like us to discuss or maybe, talk about is how do we support journalists around the region, especially those who have been arrested on these pretexts. The other thing is, how are we going to pull back from the legislation that is in place? How are we going to find, come together as a media sector or as civil society organizations, build that bridge between civil society, between the media, between, truth tellers, and pull back on the legislation, because governments are not going to remove them. We are going to have to ask for that right. Okay, we are going to have to insist on that. So maybe we can have a discussion around that too. I leave it open to anyone who would like to bring in their viewpoint.
Reyhana, I think there are some comments in the WhatsApp group, if you are there. You're muted, so I can't hear you, but maybe I can just share what Selena and Suzo have shared on the WhatsApp group.
Please do.
Yes, so Suzo is just commending Zenzele for the presentation and says what a heart-rending personal story on COVID-19. And Selena says, quite true, as the media in Malawi, we never told a story of lived experiences. And I think this is where we missed it. And reason our COVID-19 stories were basically flat. The he said or she said reporting did not help us or the public. We never, and we still are not telling the whole COVID-19 story. So I guess there are opportunities that we can pick up from. And I think lessons from Zenzele there have kind of triggered what Selena has just shared. And Emmanuel, there's a comment, I don't know, Reyhana, if you have already taken that one. There is a comment in the chat box from Emmanuel, and there's also a question. Over to you.
Yeah. The question Emmanuel poses is, this issue of rights was not really discussed by the media. It was a huge clash of rights. The right to life, right to earn a living, freedom of assembly, right to gather information, which, if at all, should have been prioritized. And yes, I agree with you, Emmanuel, the right to earn a living became the most critical issue in this part of the world, where in the informal sector is often larger than the commercial and private sector. So yeah, you know, Zenzele, if you want to take it on, if there's anyone else who'd like to, let's have a discussion going rather than being about question and answers. Thank you.
I think you've put it right, that the issue of rights is was a big issue in Zimbabwe. Probably in South Africa, I know, where soldiers were deployed, there was a problem. And a lot of us probably should have questioned why we had soldiers in the streets addressing the issue of lockdown. I know in Bulawayo also, and probably in Harare, in Zimbabwe, the brutality of the police who were implementing lockdown was so huge. We covered a story of women who were so brutally beaten up. The case is still in the courts because after covering the story, the lawyers for human rights called us and they wanted to take the case to court, and the case is still in court. There were people who were shot, there were people who were killed, and so it was really an issue. And a lot probably should have been done, and a lot still needs to happen, because right now a lot of people are, you know, if you go to a hospital and they think that you have COVID, the nurses are going to run away from you. And mainly it's because they don't have protective clothing. So for me, the reason why we have seen a number of people dying in Zimbabwe is because some of them, they died due to negligence by health officials. They will not attend to you because they're afraid they're going to actually get COVID as well. The Zimbabwe Doctors for Human Rights released a report on the Human Rights Day on the 10th of December, and they're saying over 700 health workers have been infected with COVID in Zimbabwe. And these are some of the reasons that why health officials will run away from you. And those are the stories that we should actually be looking at as well.
So Zenzele, I think on the WhatsApp chat, one of the issues was that we're not reporting enough about lived experiences. We're not talking enough about the impact on the communities. And I did pose this question to you earlier, and maybe we can go back to it. You did start going into the communities, which is what journalists should be doing. But yes, you're right, during the lockdown, it was that much more difficult. But you bypass that by going into communities. How do you think you're going to keep your growing audience? And how do you think you can connect to them? I know you talked about the podcast and you talked about, you know, the fact that there's feedback around that. But the critical issue for us going forward as the media is that we have got to become sustainable. We have got to start telling the compelling stories and telling them well and telling them accurately. And also we've got to build a rapport with communities. So maybe you can talk around that.
just yesterday, I was telling my editor that, guys, we need to keep in mind what made our audience grow. It was the stories from communities, ordinary stories that were different from everyone else. And my reason why I was raising that, I was now worried that we were going back to default mode, follow the politician kind of journalism. Today there's a press conference. Today civil society is having a meeting in a hotel. Today so-and-so is launching this, and we forget about the communities. So I was saying, let's give priority to people who have not been heard before. And that is the challenge, because it also sometimes comes with resources to drive out in the communities. But I find that communities will send us a message, say, guys, we are having, there's a lot of diaspora in Zimbabwe doing a lot of good work in the communities. So they'll be building clinics, they'll be building libraries, and for them, because they are not there, seeing those stories makes them, happy to do something. So while we are helping, or while we are holding those in the office to account, we also should not forget that our idea is about telling stories. Last week, we also did something that was different. We did a video about, if you know the history of Zimbabwe, you know that there was a king called King Lopengula who disappeared in 1893, and he was a great guy. He became to power at the age of 37 and all that. So we did a video about the disappearance of King Lopengula and what happened to him, something that happened 127 years ago. So we're commemorating his disappearance on the 4th of December, 2017. That video was one of the best videos. It got more than, I think, 14,000 or more views within a short space of time on our platforms. And I said to the guys, this is the kind of content that people want. People are tired of opposition politics. People are tired of COVID statistics that does not explain anything to them. So we need, while we keep in mind to educate people to social distance, wear a mask, and the real dangers of getting COVID, but also let's tell a story that they won't find in any newspaper, in any radio station, and we will be different that way. So I believe that, we always say it in journalism classes, local content, let's call local, but we have never broken it down. What does it mean to call local? Because going local, it means talking to, so it comes with who is your audience, and creating that particular audience, and actually just giving them something that they won't find in any way. And it's something that is difficult to maintain, because it's not attractive to an ordinary journalist in the newsroom. We tend to want to tell people what is interesting and what they should follow.
No, I think you make a very good point, Zenzele. Now, we're coming to the close of our session, and Zoe has brought up a very interesting point. One of the biggest challenges we'll face going forward, I think you can see it in the chat session, is that going forward is that social media regulation, and you can see that happening. It's happening in Nigeria currently. It's happening in Tanzania, where they're looking at regulation. And here there was a threat. I think Zenzele can back me up. There was a tweet going out that there will be no more cyberbullying of government officials. As we close the session, I want our participants to reflect on this. How do we get the public to understand that much of this legislation is very selectively applied, and it is selectively applied against journalists in particular? The other thing is, how do we start building regional solidarity? Over this period, in the last 6 months, there were more journalists that were arrested and detained than ever before last year. The Namibia Media Trust held a march and on International Day to End Impunity. And, as we close out the session, we'll look at that video. But, in reflecting on these and many other issues, I think that is what we need to look at. How are we going to build regional solidarity? How are we going to support each other? And how do we ensure that this support is maintained, even after COVID-19? And I think with that, we can bring the session to a close. There's lots more to discuss. I can see that, and I can see there's messages, but unfortunately we cannot continue. So I'll hand over to you, Teresa.
Thank you so much, Reyhana, for the beautiful facilitation, for bringing out critical issues, and to Zenzele for sharing really a personal story and how they went about taking opportunity, of course, grabbing that chance that what we would consider as a big problem COVID-19 brought. But of course, they jumped on the opportunity and also made some gains. So I guess there's something that we have learned from there. We can continue with the conversation on the WhatsApp group. I see there's a question that Suzio has asked there. Zenze, if you could also take it up. If you could also take it up on the WhatsApp platform. We will be shortly continuing with our morning session, but we will take a short break, and I will request DJ Marcus to give us a bit of some music as we go grab some coffee and come back in a few minutes' time. Marcus?
Absolutely, but before you get some music and you get your coffee, let me show the video that Reyhana was talking about. It's a 2-minute break. You can debrief a little bit. And after that, we have a 10 minutes break, okay? But first of all, please let me share the video. Okay.
In the midst of their duty to recite realities, you will find that they bring more to the surface, even that which is unseen. But if you dig and dive deeper, if you broke it all at the seams, you will find that there is more to their stories. More than what is heard, more than what is written, more than what is said. So arduous is the journey to the source, but they are persecuted. So anxious is the tale of the truth, and yet here we are, still waiting for it. We are the greater goods fools, bringing to the surface food for thought, and violated for feeding those people food for thought. Thoughts that are lined up, shoulder to shoulder, in order to be broken down and targeted with military-style shots. Yes, you will find that there is more to their stories. More than what is seen, more than what is sung, more than what is heard, more than what is seen. And so it is simple to put an end to this impunity.
Omuuonge Uozombuze.
Amaba hoasa.